Imagine you are in a country where you can't understand the language and you get deathly ill. You go to the emergency room and none of the nurses can understand your language. You'd not be able to relate your symptoms in a way that they could comprehend, so you could not be treated. This would leave you feeling alone and helpless in a time when you needed help the most. Health communication is the medium through which healthcare providers inform individuals about certain health issues and try to promote healthy changes within that individual. Though most healthcare facilities have a staff that is somewhat bilingual, public health facilities need to concentrate on this more due to the diversity of the patients they see every day. In today's presentation, I will discuss language barriers relating to the Spanish and deaf communities, and then touch briefly on the importance of studying foreign language when going into the field of public health. To begin, due to the large and growing Spanish-speaking population, there is a high demand for nurses who can speak and understand Spanish. In the 10th edition of the Cultural Landscape, An Introduction to Human Geography, author James M. Rubenstein notes that nearly 500,000 immigrate to the United States annually from Latin America, nearly twice as many as during the 19th century. This graph shows that in 2010, 29% of the immigrants to the United States were from Mexico, but when you include Guatemala, the Dominican Republic, El Salvador, and Cuba, that percentage raises to 36%. This does not account for the number of undocumented illegal immigrants from Spanish-speaking countries, so the actual number is much higher. Gurman and Becker found that in their study of Latina women's experiences in maternal health care, interpreters often were not available for the women, and as a result, staff and providers would try to make do and would attempt to communicate with women in English or by using gestures. These strategies were often unsuccessful, as women reported limited understanding when providers and staff used these approaches. They further mention that even when there were interpreters in the facility, they were not always available. Furthermore, these facts show the need for nurses fluent in Spanish. These problems are not only reserved for people of spoken language, but also for users of American Sign Language. Deaf patients who use American Sign Language are often a minority that is overlooked in healthcare. Interpreters who know American Sign Language are far and few between in public health systems. Being deaf, the understanding of English comes from reading, and many deaf adults can only read up to the 8th grade level. Most medical publications are geared toward readers of at least a 10th grade level. Deaf adults' comprehension of written language affects their quality of care. An issue unique to deaf patients is that they look at their deafness not as pathological, but as an avenue to evolve their culture. This leads many deaf patients to not trust nurses who consider deafness pathological and are usually not trained in American Sign Language. This disparity increases the risk of health problems in the deaf community because understanding of one's ailment is essential to treating it. Spanish and American Sign Language are just two examples of languages needed in public health. Proficiency in foreign language increases the proficiency of the health care received. Lastly, prospective public health nurses should be required to study foreign language to be more effective assets in public health. Being trained in a foreign language will give public health nurses more employment opportunities. Colleges offer foreign languages not only to be more available for more jobs, but also to improve cultural awareness. The biggest benefit, of course, is that the patient receives the highest quality of care. But proficiency in foreign language not only helps the patient clinically, but strengthens the patient-nurse bond, creating higher levels of trust, making patients more receptive to treatment. Having proficiency in foreign language is not limited to public health. A better understanding of every culture's health characteristics contributes to a higher global standard of health. To conclude, good communication skills lead to better health, and proficiency in foreign language broadens the number of people public health nurses can serve, which is the goal of healthcare providers everywhere. Every nurse considering working in public health field should train themselves in another language, because when the language barrier is broken, the result will be higher awareness of healthy lifestyles in society as a whole.